Welcome to New Jersey Capitol Report. I'm Rafael P. Roman.
And I'm Steve Adubato. We're pleased to be joined by two very special guests. Joe Roth, President and Chief Executive Officer, New Jersey Sharing Network, and Assemblyman Herb Conaway is Chair of the Health and Senior Services Committee in the State Assembly and also a physician by trade. Gentlemen, we're
welcome.
Here to, Raf and I want to talk about organ donation and where we are and where we're not as it relates to state law. We've done a lot of work on this, Joe. What is the current state of, I used to call it the Division of Motor Vehicles. What's it called now?
Motor Vehicle Commission, MVC.
Thank you for clarifying. What do they do right now? What do they say right now as it relates to organ donation? And what do we need to change, which is why the Assemblyman's here?
Oh, well, one, let me tell you, Chief Administrator Ray Martinez has been a strong advocate for organ donation since his tenure here in New Jersey. And he helps a lot. This is Donate Life Month, and he goes out to the MVC agencies and talks it up with the employees, how they have to ask. There is an online portal which we are working which we rely on to get people registered to be organ donors, which has helped us raise the number of registered donors who have driver's licenses to about 2.4 million registrants. We could have more. There is some confusion and some inconsistencies in the portal that make people confused as how they should proceed with it. And we are working very closely with the MVC right now to make that an easier process.
Well, Assemblyman, maybe you can answer this. Joe has been very kind to the MVC.
Well, he's in the middle of negotiations.
Yeah, he's in the middle of negotiations, and he's kind of
good cop. He's a good cop over here.
But I'm reading this stuff. You're an elected official. You can speak your mind. The way that he pictures it is much nicer than the way I read it. I mean, when people mail in their form to renew their license, they check off a box. That's if they want to be organ donors. Those things have not been collected or registered. Why is that, first of all? And secondly, he talked about doing it online. It's incredibly complex, and at the end of the whole process, you've got to send it in anyway, by paper.
Well, there are a couple of things on that. When they went, as you know, the MVC has been trying to figure out a way to be more user-friendly, and a lot of that's involved preventing you from having to go to the department, to an office to get work done. So this idea of skipping the trip, doing these other processes to get yourself re-registered, has caused a problem because the system has not, the system to receive that information has not been adjusted to take information now coming in a new way.
But how hard can that be?
Well, it is. Look, is it all of the departments?
Is it hard?
Well, the system they have for collecting this information is an outdated system. I haven't run into a commissioner, and I've talked to Ray Martinez, and I agree with what Joe has said. He is an advocate for organ donation, wants to do the right thing, but all the departments across the state government are slaves to an outdated, antiquated system. And unfortunately, folks that have been hired to upgrade it have missed deadlines, have not been able to deliver on the things that they promised.
Obamacare, anybody?
Yeah, another problem, not the subject of this show, but I'll come back and talk about that.
What would it take to improve it?
Well, it's going to take, I think, really a consideration. Now, I think they deserve some time to see if they can get their act together. People argue they've had enough time, but maybe we need to bring somebody else in, a third-party vendor, to handle some of these things that the department doesn't seem to be able to handle, particularly things on the weekend.
But Joe, didn't your organization volunteer to do a lot of this work for them?
And we have. And actually, state law does allow for us to offer services, either through volunteer help or through financial resources to help move this along. And
what have they said?
They've kind of...
We'll get back to you?
Yeah, well, we're working with them. They said that they have to run it up through the AG's office, and we've shown the
Attorney General
the legislation that authorizes us to do this. So to be fair, the governor's office is now involved. We're working with Governor's Council. They're helping us coordinate meetings and conference calls to focus on those specific issues like skip the trip and the portal. There's also the non-driver ID is another one.
And just to be clear, these are all ways, and let's be clear on this, the Caucus Educational Corporation, the co-producer of this program, has been working with the Sharing Network for the last couple of years now to try to increase public awareness about organ and tissue donation. But increasing public awareness is one thing. Being able to execute it on the other end, if you're renewing your license, is the other.
Right.
All these efforts are intended not just to increase awareness, but to be able to do something with those who are saying, yeah, I'm renewing my license. Yeah. Oh, yeah, I heard about that. I'd like to be a part of it. It shouldn't be so hard. It's hard enough to get people to say yes.
Yeah.
Well, you're right. I did the online registration, and you know, I can't say that I find it confusing. I mean, it could. I mean, I might have designed it a little differently, but you can sort of go through and put your numbers in. People are arguing, should you have to put your Social Security number in there?
You do it now. You have to do it now.
They want to be able to verify that someone's, I guess, not signing you up. I guess
Okay.
If you get a number.
Right.
I mean,
but don't you have to mail
it
in after you? Don't you still have to mail it in?
No, they
That's
send
not
it to you. They send it to you.
Here's what I'm curious about. Are there other states, Joe? You work with your colleagues across the country. Is there another state who has this right?
A lot of other states have basically one-screen registration features that are either hooked in through their, that are tied through their motor vehicle commission. Either the motor vehicle commission has the data residing in it, or the motor vehicle commission is a conduit of information to the registry that's housed either at the organ procurement organization or through another third party.
So it's not like this can't be done and hasn't been done in other states.
Absolutely can be done.
By government, state government,
Yes.
just other state governments.
Yes, yes.
So we understand this. Put the numbers in perspective. We've done it on one-on-one on Caucus, New Jersey, our sister programs. How many people are waiting in New Jersey?
Over 5,000 New Jerseyans are registered waiting for transplant.
Of such organs as?
Oh, hearts, lungs, livers, kidneys. Kidneys are most prevalent.
A lot of people waiting for it.
Right.
And then there's this bottleneck. So lives are at stake.
Absolutely. I've said it before.
People are dying because of the
yes.
problems here.
People are dying for lack of organs. If we could reach a critical mass of people who are registered, it makes our lives a lot easier because in New Jersey, as it is in most other states, it's a consent registry. So when a person shows up and we know their wishes have been made, we can walk in with the family and make the decision a lot, not even a decision, make their lives a lot easier because they don't have to make that decision.
All right, let's talk about a couple of other things that can be done aside from making the MVC more efficient. You have legislation in the works. What does that do?
Well, you know, there are a couple of things that I'm looking at in terms of changes. One of the things that, you know, once you sign up, should you have to reaffirm? That is, we do have an opt-in policy, and I think that's probably appropriate. We'll discuss that if people think we ought to be doing otherwise. But once you are in, it seems to me you shouldn't have to reaffirm. That might be a time.
Reaffirm meaning I just said I want to donate my organs.
And that should
Why
be
asking me
forever.
again?
That's right.
Yeah. And
so,
if I change my mind, I'll let you know.
That's right. That would reduce some of the administrative back and forth, and it should put upward pressure on those numbers. Education for children, children.
What do you mean?
My age, but kids going on as they're high school. Well, there's already a curriculum requirement to have this discussed. But as you're going through the driver's education process, and particularly now that a lot of this is now happening outside of schools, because I got my driver's, you know, I did my training in school. A lot of people are going out to private agencies now. We want to make sure that as folks are learning to drive, that they're given this information at that time as they go to sign up for their driver's license. It's just one more opportunity to educate someone about what they need to do.
We have a minute. One of your colleagues in the Assembly wants to make it an opt-out, that everybody's assumed that there are donors, and you have to say I'm not. Good idea?
Well, I think, you know, it's something worth discussing, and I would be interested to see what the legislature feels about it and to hear from the public on this idea.
Do you like this? Opt-out?
Opt-out poses a different problem. Right now, an opt-in is do the right thing, do the good thing. Our promotion would have to be, please don't put your name on the no consent registry, and so that would pose a problem for us from a marketing standpoint.
I promise you we'll continue both on Capital Report and our other programs to monitor the situation and continue to let people know so that they can make the choice for themselves. Thank you, gentlemen. Appreciate it.
Thank you very much.
We will be back with Capital Report right after this.